we are continuing lecture at lecture 2. This lecture we focus on the typical introduction of the acupoints, right? The common acupoints. So here we look at what is acupoints, yeah, and what are the specific points, right? And still we discuss therapeutic properties of the points. And still important methods of the locating points. Then you can do, right now you can do practice and by yourself, right? Find some points. Yeah. Next week we can do that. So what are, acupoints? How to define acupoints? Acupoints, you can see the traditional definition like a specific sites through which the qi, the energy of jiang, fu organs and the channels, is transported to the body surface. Yeah. So acupoints, if from modern medicine you understand, acupoints can really deliver a lot of signals. The acupoints really can regulate body energy, level, regulate the organ functions, right? So still acupoint pathways for the circulation of qi and the blood. We talk about pathways. This, pathway is composed of so many acupoints, right? And still low C of the response to disease. Sometimes we can regard the acupoints like reactive points. Yeah, sometimes very sensitive. Sometimes even you can know uh, earlier than the instrument, the body examination and what happened to your body. Yeah, that means the acupoints can diagnose some, pathological changes earlier, right? Sometimes very beneficial and helpful to tell your clients, maybe refer a client to some body examination. Sometimes can find, some disease earlier, right? Try best to prevent, right? Prevent disease from becoming worse. So next one, acupuncture on the body. Come back. Yes. Okay. Come back. Acupuncture still. So it's board and the full screen. Come see slides. You check whether I could write down something. The surface pain. Why does not work? Sound like okay. That's good. Okay, the acupoints we see. Acupuncture on these points regulates the functional activity of the body and strengthening the body resistance to prevent and treat disease, right? Important acupoints. But from acupoints, acupuncture needle just one method or one tools, you know, for the treatment. But sometimes we still can use massage on the acupoints, right? We can use some compression on the acupoints called acupressure, right? Yeah. Still, we can use the tapping needles, or we call the plum needle, the 7-star needle, to working on the point to regulate the body health, right? Okay, next one. Classification of the acupoints. There are so many types, different, so many different types of acupoints. Number one, regular points, channel points. We have regular points, acupoints about 14 meridians, right? 14 meridians. 14 meridians. And 40 meridians, they're, sorry, come back. 40 meridians, we know the regular points about 366, but still have later generation, a lot of practitioners still have, they invented so many new points, right? Invented so many new points, extraordinary points, and still arch points. Arch points is not fixed points. They based on body conditions, right? They come and go. Yeah. So still other points include ear points. We call the auricular acupuncture, a lot of points on the ears, and the scalp points, still a lot of points and the lines on the scalp or the head, and the tongue points and the eye points. So many different types point system. How to name, traditional, the regular acupoints, how to name these points. Names is bearing the analogy to water flow and the mountains and the valleys. Example, like a chi. Yeah. A lot of points use the metaphor water, water. Yeah. Chi like a crooked point, right? It's a number 11 points on the large intestine channel, right? And I still have the Chizo. Chizo still there is the mush, after mush, long file. Still like water, body, just different types, water, body. Yeah. And Shao Hai. Shao Hai, high like sea, young sea, right? Heart 3 points. Number 3 point on the heart channel. Still we have the Tai Yuan, long nine, right? Great deep pool, great deep pool, Tai Yuan. Yeah. Still He Gu is a Li4, very big points, connected valleys, connected valleys. But translation, English translation may be a little different. Some North America is different. I mean, Canada is still different from the USA. Yeah, but we try best to understand the meanings. Meanings of the names. Yeah, and still Liangqiu is like hill range. Hill range. Liangqiu like mountain, right? Small mountain like a hill, right? So many points. Later on, we discuss every single point, especially the special important points. Yeah. Okay. The number one, naming method, right? Number two, names bearing analogy to animals, plants, and utensils, right? Number one, 玉姬, animal, fish body or back, right? 玉姬, long tail, fish body, 玉姬. 杜闭, stomach 35 points, calf's nose, calf nose, 杜闭, like, small, the calf's nose, really, really vivid, right? Number three, names bearing analogy to the architectural structure. Number one, Shenmen. Yeah, human in the acupoints, a lot of names. It's just metaphor to the gate, like gate. This one, we call the heart 7 called the Shenmen, means spiritual gate. Spiritual gate. From the name, we know this point can regulate the Shen, regulate spirit. Still have 10-2, Ren 22, the heavy chimney, heavy chimney. Yeah, very metaphor in the upper body, right? Heavy chimney. Seem like open, like a window, connect to the heaven. 内庭, stomach 44, interior counter yard. 内庭. This one metaphor like, you have the house, you have the yard, right? 内庭. Still have 风势, GB31, 风势, GB31, wind fair, wind fair. So vivid, right? Wind pair. Number 4 is a name bearing analog, uh, analogy, right? Names bearing analogy to astronomical and meteorological phenomena. Uh, Meteorological phenomenon, a lot of you talk about universe, talk about cosmos, right? Astronomical. Haitian people still observe what happened on the phenomenon in the sky, in the sky. So is the 日月. The metaphor 日月, we have, the sky has sun and moons. The human body still have this GB24, 日月, yeah. And the 上星 is due 23, is upper star, yeah. Okay, Feng Chi is GB20, like a wind pool, a wind pool. This from name we see Feng Chi GB20 really can disperse or clear the wind. Now, wind is pathological pathological factors. Still have 10-2, rain 22, heavy chimney. Sometimes seem like a phenomenon, right? Meteorological phenomenon. Yeah, heavy. Yeah. Number 5, points named according to their therapeutic properties, like 肺腧. A lot of Bechdel points. 肺腧, blend 13, the long point, is regular lung function, right? 光明, 光明 means brightness. GB37, 光明 really can regulate the eyesight. And 血海 splinting, 血海 is sea of blood. It benefits blood, can clear blood heat, and can benefit blood deficiency. And 官员, the rain 6, storage of the primary qi, original qi, primary qi. So the 印象 is typically welcome fragrance, Li20, 印象 really can benefit the nose, treating a lot of nose obstructions, nose, stuffy nose, and some of the chronic rhinitis, maybe lose smelling function, right? Especially COVID-19 still can damage the olfactory nerves. Finally the people cannot smell anything. Yeah, the fragrance, welcome, 印象. Still another one. So specific points. How many specific points? We discussed that, right? Specific points, points of the 14 learning that have special properties that are grouped under special names. Because Asian people practice so many years, they know their specialty. The points are so different. Some points have wide, powerful, therapeutic effect. Some points is a common local effect, different. So here we listed about the 10 different categories of the special points. Number 1 is the facial points, right? Number 2 is a primary, UN primary points or UN source points, Number 3, lower connecting points. Yeah, lower connecting points. Number 4 is C cleft points. 16 C cleft points, 16. And the number 5, 8 confluent points. Here is the 6 backshoe points, right? Front move points, crossing points, 8 influential points, and the lower Hersey points. Yeah, we talk about one by one. Number 1 is here. Yeah, here's lower Hersey point. Some book didn't mention. Here is another category. We just call it crossing points. This is from the Peter. His book, manual acupuncture, and mentioned crossing, but so many crossing points. We don't need to memorize every point in the crossing, this category. But 9 from 1 to 9 and still plus lower Hersey point we should memorize. Right here, lower Hersey points, right? And still, let me check. Yuan source, low connecting, yeah. Crossing point, yeah, same. the same method to classificating. Okay, number one is the facial point. Facial point. Facial point, each of the 12 regular channel has 5 specific points located below the elbow and the knees. You know, the facial point is very popular. They are safe. They treat a lot of conditions, but they are distal points, but they can treat the trunk problem. They can treat the center, your body center's problems, right? You don't need to puncture the trunk so much, right? So very safe. So from the according to the spiritual pivot, Ling Shu is a very old book. Number one, Jingwell points, they call the bubble. The bubble seems like the metaphor, like water, Jingwell points. It seems like think about the water flowing. We can look at this picture. It's like water flowing from Jingwell, right? Here is Jingwell. Jingwell points in the Yin Spring, then like water, small water, small water will become bigger and bigger, bigger and bigger, right? You come back see. It seems like bubble. Think about water, bubble, right? It's mental disorders. Yeah, a lot of people a little crazy, acting, psychosis, little bit, vexations, and the fullness of the chest. They regulate chi so well. Number two is yin spring point. Is gush, febrile disease. The water become bigger and bigger, little heavier. So the yin spring point a good point to clear heat. Febrile disease, a lot of heat in the body. Number three, the shoestring points is the flourish. Flourish, the water become more and more, right? So it's treat body heaviness and the joint pain. Shoestring point is very good painkiller points. Painkiller points. Number four, Jing River points, pouring abundantly. So this point, more water, yeah, than the shoestring point. So you can treat asthma, treat the internal organ disorder, a lot of internal organ disorder, asthma, pharyngeal, pharyngeal, gale disorders. You can see, yeah. Then the like throat, like the voice cord disorders, yeah. So the number five, Hersey point. Hersey point is meeting the organs, right? Meeting the organs. That means this Hersey point can regulate organ disorder directly, because every regular, the points, regular channel point has the Hersey points. Every we know the 12 channels, regular channels. 12 channel means 6 organs, full organs and 6 zang organs, right? 6 full and 6 zang. So Hersey point regulate zang or fu directly. 6 full organs dysfunctions, but also I think we can add still 6 zang organ direction dysfunctions. Yeah, 6 full, 6 zang. Yeah. Okay, this chart from the manual acupuncture, the picture. So it show you how vivid the water from the light water, very small water, and then gradually become bigger and bigger. Yeah. So same like that. This is metaphor. It's metaphor. Yeah. The bubble gradually to the yin spring, to the shoestring, right? To the Jing River, right? Become sea, right? Water become bigger and bigger. Yeah, still from deep to the surface to the shallow. So here's about compatibility of the facial points. It's listed 6 full zang organs, right? 6 zang organs, the Jingwell Yin Spring and the shoestring and the Jing River and Hersey points, and still 6 full organs corresponding. Later we talk about every channel. When we talk about every channel, we discuss detail about the facial points. Yeah. Lower Hersey points. What are lower Hersey points? And 6 points of the 3 young channels of the hand and foot, where the downward flow in qi of the 6 full organs along the 3 young channel of the foot and the 3 young channel of the hand meet. So the lower Hersey point means we know that we have 6 full organs, right? The lower Hersey points can regulate corresponding the full organ disorder, But these Hersey points, they are all located in the lower limb. Lower limb. Yeah, that's why I call the lower Hersey points. Even large intestine channel. We know large intestine channel on the upper limbs, but it's lower Hersey point in the lower limbs, on the stomach channel, right? Yeah. When we talk about that, we can talk detail about that. Most of them are distributed around the knee joint. Most of them are distributed around the knee joint. Yeah. Treat disorder of the 6 full organs. Remember that. Lower Hersey point treat disorders of 6 full organs. Yeah. Here listed lower Hersey point. Yeah. And Peter's book, I didn't see. He wrote it in the common pages. I didn't see a record lower Hersey point. But here we have to tell you, yeah, lower Hersey point. Sometimes test you. Yeah. So next one. Next category is the yuan primary point or yuan source point. Yeah. Both translations are good. Each of the 12 regular channel has a yuan source, yuan primary point. Located on the limbs. Yeah. Located on the limbs. Whatever upper limb or lower limb. The yuan primary points of the yin channel and overlaps with the shoestring points of the 5 shoe points. Remember that. All the yin channel, whatever upper limb yin channel and the lower limb yin channel, right? Where yuan qi is retained. Yuan qi retained, we still use acupuncture, use needles, or you can stimulate and activate the yuan qi. Where yuan qi is retained. Treat the zangfu organ disorder. Zangfu organ disorder corresponding. Yeah. So here are all the 12 yuan primary or source point, right? Lung intestine, and stomach, spleen, heart, small intestine, bladder, kidney, pericardium, and sanjiao, and gallbladder, liver, right? Yeah. Go next slide. Lower connecting points. They're special too. 1 point for each of the 12 regular channels and the ring and du channels and the major collateral of the spleen. So they are termed 15. Remember, 15 lower connecting points, right? 15. So we call the 12 plus 1 plus 1 plus 1 equal 15. Yeah. So they are used to treat a disorder involve the two externally internally related channels and those in the areas supplied by the channels. Yeah. So low connecting point means the really 1 point can regulate both channels. Example, low connecting point on the lung channel. They can, of course, it can regulate lung function, right? But also still can regulate large intestine function. Yeah, they call the law, like a messenger. They make the two channels, make two channel switch some message information. Yeah, here list of all the low connecting points and the yuan source point. Because here you can remember a lot of time future we can some disease, especially chronic disease, we can pair yuan source points and the low connecting points on the same channel. Example, lung channel. We can lung 9 is yuan source point, pair with lung 7, low connecting points to strengthen the function to regulate lung disorder, right? Yeah, same. Heart, pericardium, spleen, kidney, liver, large intestine, small intestine, triple energizers, and sanjiao here. Stomach, urinary bladder or bladder, and kidney. Yeah, gallbladder, kidney. Yeah. Still have the some gallbladder and the liver, right? Gallbladder, liver stuff. Yeah. So next slide. Yeah. Number 7 is the friend move points. Friend move points. From name, it located body friend. Move. It seems like the convergence of the energy, right? Convergence energy, gathering energy. Located on the chest and the abdomen, close to their corresponding organs. That's interesting, right? Close, real close. Friend body, a lot of organs. Yeah, a lot of organs. So the where the qi of the respective organs is infused and converged. Yeah. Okay. And important for both diagnosis and treatment of disorder of the internal organs. Example, Friend move for the stomach channel, you know, it's but this friend move for stomach channel not on the stomach channel itself, it's on the ring channel, on the ring channel. So it can regulate stomach disorder, right? So here a lot of list about friend move points, right? 12 Zangfu organs, right? And especially, we see stomach channel, stomach, the friend move point on the ring channel, it's called the ring 12, right? Spleen points, friend move points on the liver, liver channel, right? And the heart channel points on the ring channel too, CV channel, right? Conception. Small intestine, friend move is on the ring channel too, right? And the liver on liver is good. Gallbladder is on gallbladder. Sanjiao, but it's not on the Sanjiao itself, it's on the ring 5. Pericardium is still on the ring 17, on the ring channel. Kidney, not on the kidney itself, on the GB channel 25. Remember that. Bladder channel is still on the ring channel, and not on the bladder channel itself. Next point. Oh, the number is a little different. Okay, and the number 6, backshoe point. Here should be previous should be 6. This one should be 7, right? The backshoe points. Yeah. So located on the back, closer to their respectively related Zangfu organs, on the back shoe. All the backshoe points, yeah, located on the bladder channel, where the qi of the respective Zangfu organs is infused. Okay, present the abnormal, present the abnormal reactions of the dysfunction of the organs, right? It's very strict. Imagine lung shoe, right? Just treat the lung disorder. Heart shoe, treat the heart disorder, right? And the liver shoe, treat the liver disorder. And spleen shoe, treat the spleen disorder organs, right? Treat the disorder of the internal organs. Here listed, you see, all the backshoe points is the number is the letter is bladder or UB, right? Bladder UB. Different numbers, but the letter are right on all the backshoe points on the bladder channel. Next one, we talk about 8 confluent points. 8 confluent points. 8 points where the regular channels communicate. The regular channel communicate with 8 extra channels. Seem like crossing points, but they crossing not just regular channels, it's crossing with extra channels. We call it 8 confluent points. So located on limbs, of course. Treat a variety disorder of the corresponding 8 extra channels. Yeah. I mentioned a lot of tough disease, chronic disease. Sometimes you use regular channel point not working well. Think about these 8 confluent points, right? And here we are, right? So lung 7 is on the lung channel, no doubt, but also they connect to the conception channel. So lung 7 can benefit females disorder. And the governing channel is SI3 on the SI channel, but still can regulate dual channel disorder, right? Same like SP channel, spleen channel 4, but connect to the Chong channel, a penetrating channel. It regulates a lot of blood disease, or especially for female menstrual cycle disorder, Yeah, same like a girdle. Belt channel is GB41. GB41 on the GB channel, but it can regulate belt channel disorder. And the KI6 is on the kidney channel, but they can regulate yin motility disorder, the channel. Yang motility is still on the bladder channel 62, right? Yin linking, yin wei mai, we call it yin wei, and still PC6 on the PC channel, but they can regulate yin link disorders. And yang link, yang linking, yang wei. So it's Sanjiao 5 on the Sanjiao channel, but they can regulate yang linking channel. Yeah. Future, you can know what's this function of these extra channels, the 6. You can learn later on in the advanced acupuncture class. So 8 is 8 influential points. Sometimes manual acupuncture called Hui meeting points, but the college use influential points. Use this word, influential. They are the gathering points where the vital, very precious energy and sense and energy of zang, fu, qi, blood, tendons, vessels, bone, and marrow joined together. So that means, in other words, this point can regulate zang organ disorder, fu organ disorder, all the qi, qi level disorder, and blood disorder. Now, disorder having to the tendon, vessel, bone, marrows, right? Yeah, it is influential. They are distributed on the trunk and the limbs. Yeah, it is influential points, three meaning points. So they are used to treat disorder of zang organs, fu organs, qi, blood, tendons, vessels, bone, and marrow. Here we are, right? You look at here, right? Liver 13. Liver 13 can regulate, but on the liver channel, but they can regulate all the zang organ disorders. Sinew, all the tendon injuries, some of the ligament injuries, you can think about GB34. It can benefit the whole body. Like a long night, it will benefit vessel because long night closer to the arteries. We know that, right? And Zhongwan, RAIN 12, we know still Zhongwan is a stomach friendly move, but also can regulate all the full organ disorder. Yeah, same like, right? The bone is Dazhu is bladder channel points 11, but they really can help regulate bone disorder, especially deficient in bone. And the qi disorder is especially qi stagnation, RIN 17, on the rim channel, but the benefit the whole body qi stagnation. The blood, the Gershu, blend 17 on the back, blood channel, the regular blood disorder, especially blood stasis and the blood deficiency. And marrow, Xuanzhong, GB39 on GB channel, but they can regulate marrow disorder. Now, what kind of marrow disorder? Similar like the person have kidney deficiency, the marrow deficiency, the person show a lot of weakness in the limbs, right? Weakness in the lower back. And number 9, C-cleft points. C-cleft point is the one point of each of the 12 regular channels and 4 extra channels, like yin qiao and yang qiao, yin wei, yang wei, right? C-cleft. So totally 12 plus 4 is 18, 16, right? 16 C-cleft located on the limbs. C-cleft will treat, remember, acute disorders in the area of the channel and those of its pertaining organs. Example, lung 6 is C-cleft for lung channel. So it's good for, acute conditions, typically bleeding disorder, nasal bleeding. Yeah, the person have suddenly, bleeding from nose, right? Heavy bleeding, sometimes it's scaring the person. Yeah, think about lung 6, C-cleft. Yeah. So we have a lot of list here, right? Different. We talk about detail later on. Yeah. And also crossing points. So many crossing points, right? I think more than 100. They are at the intersection of 2 or more channels distributed mainly on the head, face, and the trunk. And the total of more than 90. Yeah. They are the key points to treat channel disorder or areas where they are located. Yeah. The crossing point and one point regulate more than one channel. Right? Okay. Next slide. We talk about the points actions. Yeah. Point actions. Let me check. Yes. Yeah. Action. So many acupoints. How to understand, how to memorize these points, action especially. A lot of special points, especially facial points, especially a lot of points below elbow, below knee joint. They have very amazing remote distal therapeutic properties. These points located on the limbs, especially those below the elbow and the knee joints, treat local disorders, right? Treat disorder of remote zangfu organs and the tissue on the course of their pertaining channels. Some points have systemic therapeutic properties. Some points. Especially we talk about special points. Example, if you treat back pain, sometimes we don't, maybe you think you little bit scaring, you puncture on the back points, you just puncture distal on limbs. Example, the Blender 65. Blender 65. Blender 65 really benefit treat back pain, especially shoulder blades. So a lot of people suffer shoulder blades pain. Yeah. Second, acupoint. Some acupoint maybe just a local adjacent therapeutic properties. That's still very useful. It's very useful. All points have the therapeutic effect on the local and the adjacent areas. Example, a lot of persons suffer neck disorder, stiff neck, and the person still suffer arm, numbness because the nerve be compressed because of neck disorder, right? Local points we can add, right? Blender 10, GB20, and still Blender 11, right? These local points benefit neck. Also shoulder as well, right? Shoulder will future we learn LI 15 and the Senjo 14 is very special point, local point to the shoulder pain and frozen shoulder, right? Local adjacent therapeutic properties. Number 3, biphasic regulation of the acupoints. A lot of points can two-way regulations. Example, typical 内关, PC6, can correct both tachycardia and bradycardia. Tachycardia is very rapid, heartbeat racing, heart racing, so fast. And bradycardia is very slow, maybe below 60s, maybe below 50s, around 50, 40s, too slow. But PCC can regulate both conditions. So number 4, special therapeutic properties. Do14, 大椎 on the do channel has antipyretic effect. Yeah, 大椎 really can strengthen energy, healthy qi, strengthen immunity, and really can help to kill the germs. And still Zhiyin, blend 67, treats male position of the fetus, right? Sometimes very helpful and safe. Okay. Method of locating points is a very important part. Future we talk detail. All the acupoints have to find the right location. You know how to locate them, how to puncture them. So, in the traditional way, there are so many methods to locate the points. Number 1, anatomical landmarks. Especially we should know, anatomical structures. If you understand anatomical structure, you understand how to use these anatomical landmarks to find the points. So number 2, finger measurements. Use the finger very prominent, and because some points maybe don't have a special landmark to locate, you have to measure them, right? And then number 3, proportional measurement. We call it twin measurements. Twin measurements. This is most accurate methods to locate the points. We can measure proportion measurements. Every category or region of the body have different twin. Yeah, when we talk about what is twin, right? What is twin? Head, head and neck, trunk, upper limb, lower limb. And still some the very special quick measurements save your time. You don't need to measure by the twin. You just use a very simple way to locate the points. Yeah. So anatomical landmarks, anatomical landmark is so important one. Yeah, even we can use like a proportional measurements, like a twin measurement, but if you don't familiar with anatomical landmark, still you could not locate the points accurately. So important. We learn, you learn with palpation anatomy with Ian. Try best to learn well. It really help us to locate the points. Fixed landmarks, right? Like 5 sense organs, around the eyes, around the ears, around nose, around mouth, there are points. There are a lot of acupoints. Hair, hairlines can, fix the landmark. And the nails and nail bed, you find Jingwell points and nipples and have you locate the chest points, right? On the chest points. And umbilicus have you locate the points around the belly, right? Belly around. Permanence, a lot of bony landmark, permanence, right? And depression on the bones. Yeah, a lot of depression on the bones. We palpate to find it typically for the Ba points, right? Blend channel point, Ba on the blend channel. Yeah. So here are the yin tang, extra 1 points, but between eyebrows. Yeah. And Su Liao is on the table nose, based on the fixed landmarks. And the Shen Jue on the belly button, in the belly button, ring 8, CV8, ring 8. And still number 2 is the moving landmarks. The moving landmark example, the creases. The future discuss about the cubital creases and the poplite creases, on the elbow, on the knee joint, right, back on knee creases. They have located the points around them. And but here didn't mention the slide didn't mention like other the landmarks. Is muscle important, tendons are still so important, right? Muscle tendons, because here the crease is just surface the landmark, but use our finger we can find a deep some anatomical landmark. Yeah, anatomical landmark, especially a lot of back point we have to find the spinal process of the vertebral body. They find the TVP, especially on the neck, right? We have to find the iliac crest, locate the points. Yeah, still find some like sacral foramen, right? Sacral foramen on the back, lower back. Yeah. So number two. Yeah, number two is we talk about the finger measurements based on the fingers, the length, right? Some measurements, I think intercostal phalange joint, right here, right? Interphalange joint right here, the thumb. Just between the two sides, you can take it as one twin length, one twin distance, one twin distance. And the number two, middle finger measurements. Middle fingers, it seems like this. Middle finger, like from, you know, the middle finger is bent in the middle segments, between the two, like a proximal and distal interphalangeal joint. You can find the distance, it's called 1/2, right? For the index finger, we can use like from tip the fingers to the proximal interphalangeal joint, like a 2 twin, right? They have you quickly locate the points. And still the four-finger measurements. Four-finger measurements like a 3 twin. But four-finger have to, little bit close tightly. Don't just spread. A third finger not so accurate, right? You close tightly. Four-finger, 3 twin. And the two fingers, oh, two finger easily 1.5 twin, right? Half, right, of the 3 twin. So 3 twin, right? The 1.5 twin. Yeah, two fingers. It's for the finger. But in the clinic, the third, method, important method, the proportional measurement, the twin measurements, important. This human body has traditionally been measured according to the proportional units known as twin. Yeah, remember the proportional units as twin. Yeah, the twin, that means maybe everybody they are different. The individual different because their body size different, the twin is different, right? The real length. Yeah. So the twin measurement system is indispensable in accurate location of the acupuncture points. Yeah, relatively it is accurate. Yeah, but in my point of view, still combine the bony landmark, the anatomical landmark, then you can find the accurate location of the points. Since it is a proportional measurement system, it is equally applicable to adults or children, to thin or obese subjects. And whatever your big size, small size, whatever tall or short, yeah, it's same, work well. Look at this chart, you understand that, right? But maybe the lengths are different, but for one person, the twin, relatively we give the number, whatever man high, tall, little thinner, or maybe the obese, the 16 twin, right? 16 twin. Yeah. Remember, proportional unit, right? Not real length. Real length different. Look at here. Real length different, right? So head, we talk about head, Here distance, number one, distance between, the anterior and posterior hairline is a 12 twin. What's the benefit? Here later on we locate the dual channel points. So beneficial, so useful, right? Dual channel points on the head. And still distance between the glabellar and anterior hairline is 3 twin. They really have your dual channel points right here. Still have you like locate the blended channel points and the GB channel points right here, the head. And still the distance between the anterior angles of the hairline is 9 twin. Same like corner right here. The two corner connected 9 twin. Next one is on the head and neck, back, head, and neck. Back, head, neck. Back, head, neck in the hairlines right here. You know, distance between the mastoid process. You have to find the bone in landmark, right? Mastoid process is 9 cun. Still distance between the posterior hairlines and the posterior, you know, posterior hairline to the inferior border of the C7 is 3 cun. It's 3 cun. This 3 cun. Okay. The trunk of upper limb, we know have the forearm is 12 cun, right? Upper arm is 9 cun. Right here, 12 cun and 9 cun right here. But from the axillary fold to the cubital crease right here. From the cubital crease to the wrist crease is 12 cun, right? 12 cun, yeah. And the shoulder blades, between shoulder blades is 6 cun. You know, left shoulder blades and right shoulder blades is 6 cun. In the middle, you know, from the shoulder blades to the spinal cord, you know, vertebra, yeah, spinal column, and it's 3 cun, right? Half is 3. 3 plus 3, 6. Yeah. Next one is the trunk. Trunk is so many, you know, cun. Distance between the medial border of the scapula 6 cun. Distance between the nipples, nipple 8 cun. Remember this, nipples. But especially for men, it's very accurate. But for female, sometimes if the, you know, female breast is a little larger, it's not so accurate. The distance between the midpoints of the clavicle is 80 cun. Yeah, remember, find the clavicle, right? Distance between the tip of the acromius, the process, and the midline of the body is 80 cun, right? Midline body is acromial process. Acromial process is on the scapula, right? 80 cun, just one side 80 cun, midline. The distance between the sternocostal angle and the umbilicus is 80 cun. We know sternocostal angle in the middle, it's along the chest bone, right? Umbilicus is the belly button, 80 cun, yeah. So it's the upper belly, seem like, right? And distance between umbilicus and the pubic symphysis. Umbilicus, we know the belly button easy to find it. But the pubic symphysis, you have to palpate a little bit, right? Find 5 cun. The distance between the end of the axillary fold on the lateral side of the chest to the tip of the 11th ribs, remember this, 12 cun, because we help us to locate the GB channel, liver channel points, right? Axillary fold in the side body to the tips of the 11th rib. We know the 11th rib is a floating rib. Floating rib, we have to palpate to find it. Next one is upper limb. Upper limb is the distance between the end of the anterior axillary fold and the cubital crease is 9 cun. We mentioned, right? 9 cun. Yeah. The distance between the cubital crease and the wrist crease is 12 cun. Remember this. The lower limbs, so many cun, different cun, right? We can look at here, lower limb. The distance between the lateral, you know, prominence of the great trochanter. Yeah, great trochanter, you have palpate, find the bony landmark, approximately level with the inferior border of the pubic symphysis, right? And the popliteal crease, you have to find it. Popliteal crease on the knee joint, right? It's 19 cun, 19. The distance between the upper border of the symphysis, pubis, right? Pubic symphysis, or maybe symphysis of pubis, same meaning, upper border. Then to the medial epicondyl of the femur is 18 cun, 18 cun. Because you have palpate to find the pubic symphysis, then find the medial epicondyl of the femur, medial epicondyl of femur. Yeah, it's a little distal end or a femur, right? Distal end of femur. Remember that 18 cun, 18 cun. Yeah. Next one, height of the patella. Remember 2 cun. The height of patella, the kneecap. Okay, I talk one more about 1 hour. Okay, I talk slowly, a little voice the course. The distance between the gluteal fold and the knee joint is 14 cun, right? Have to locate a blended channel, you know, back of the sign, back of the knee joint, right? So is the distance between the gluteal fold and the knee joint is 14 cun. Yeah. So lower limb. Still on the distance here. Distance between the popliteal crease. pelvic crease on the back of the knee, right? To the tip of the lateral malleolus is 16 twin. You have to locate the blend channel and the GB channel points. And the distance between the pelvic crease and the tip of the medial malleolus is 15 twin. Remember that. One is the lateral malleolus. That means lateral side, outside, right? It's 16 twin. And the medial malleolus is 15 twin. The inside, right? Inside the leg and the knee, right? Pelvic crease. That means medial malleolus a little bit higher than lateral malleolus. Yeah, lateral malleolus a little bit distal to the medial malleolus. So distance between the center, lower border of the medial condyle and the tip of the medial malleolus is 13 twin, right? So medial condyle between the center of lower border, center lower border of medial condyle. Medial condyle, you know, which bones? Here didn't mention. Okay, should mention medial condyle of the tibial bone, and to the medial malleolus is 13 twin. Distance between the tip of the malleolus and to the heel is 3 twin. The between, you know, tip and the malleolus to the heel, 3 twin. Look at here. And look at the picture. Here mentioned about, you know, okay, lower limb. We cover all the lower limb. Right here is still the chart. Have you memorized all the, you know, lower limbs, head, chest, abdomen, the back of the wrist, upper limbs, yeah, and the body parts and lower limbs, yeah, lower limbs. So here this chart have you very vivid to help you find all the twin in the whole body. It's very useful, very useful. Yeah, you take time to read all the stuff. Okay, read all the stuff. It's important. You still you have to understand the bony landmark, anatomical landmarks, right? If you could not find this anatomical landmark properly, you could not measure the right twin properly, right? Yeah. Here is still another chart have you memorize. Yeah. Okay. Yeah. So still have quick measurements. We know the fingers. It's use the fingers just twin measures, you know, find the points. Yeah. Here are notes. It is most accurate to locate the point by using the above system of measurements. Use twin means twin measurement, proportional measurements. In practice, experienced practitioners often use hand measurements as above, right? But I think better we still familiar with anatomy, important anatomy. We should know palpation. Not only surface anatomy, still deep anatomy, you know. It is important to remember that it is the dimensions of the subject hands rather than the practitioner hand, right? That should be used, you know. That's another issues. In the practice, sometimes you have to measure user, you know, patient's hand, right? Client's hand. Sometimes not so convenient. So for my practice, better still be familiar with anatomical landmark. This really help you find the points. However, beginners should always locate acupoints based on their proportional measurement that is more precise, of course. And for examination purpose, points must be located based on the proportional measurements. Okay. That's end of lecture. Thank you, guys. Thank you so much. I just have to finish and recording and stop recording and being recorded. Are you sure to want to stop? Yes.